Hello, it's AFDO's 125th anniversary, and to commemorate it, we'd like to take you on a little journey through our history and mark a few of the milestones along the way. We begin in 1896, when Joseph Blackburn, the Food and Dairy Commissioner for Ohio, meets with his counterpart from Michigan, Elliott Grosvenor, in Toledo, Ohio, to develop the foundation for an organization whose mission will be defined by the promotion of regulatory uniformity. Our initial meeting takes place August 25th, 1897, in the Turkish Room of the Cadillac Hotel in Detroit, Michigan. Thus began a nationwide professional association combining the best talents of government officials at all levels, industry, academia, and consumers. Many important and colorful individuals participated in our association, but perhaps no one more influential than the father of food and drug law, Dr. Harvey Washington Wiley. Wiley became chief chemist for the U.S. Department of Agriculture in 1882. After assisting Congress in their earliest questions regarding the safety of the chemical preservatives then being employed in foods, Wiley was appropriated $5,000 in 1902 to study the effects of a diet consisting in part of the various preservatives on human volunteers. These famous Poison Squad studies drew national attention to the need for a federal food and drug law. Wiley soon became a crusader and coalition builder in support of national food and drug regulation. It is here where he became acquainted with our association. In 1906, the biggest success of Dr. Wiley's career was the passage of the Pure Food and Drug Act. He consolidated his allies that included segments of business, state agricultural chemists, physicians, women's clubs, reform-minded journalists, and organizations such as ours to pressure President Theodore Roosevelt and Congress to pass the law. President Roosevelt would sign the act into law on June 30th, 1906. One of the heroes of the Pure Food and Drug movement, as credited by Dr. Wiley, was Commissioner Edwin F. Ladd from North Dakota, who would become the association's president in 1908. In 1913, the association passes a motion recommending the formation of an Office of State Cooperation, which would eventually become FDA's Division of Federal-State Relations, and today, the FDA Office of Partnerships.
Our main job is to be a conduit between the states and the FDA. And when I say states, I'm talking about state, local, territorial, and tribal. It's a little easier just to say states, so I'm going to stick with that. And our whole job is to solve problems and to pull people together to address uniformity, standardization, and any sort of quality issues we need to, as well as advancing mutual reliance. So therefore, my office may be 78 people now from the original 15 people. And it's a small office, but we pull from subject matter experts internally in FDA and externally. So our mascot is an octopus, and we kind of say our tentacles are everywhere.
1927, AFDO produces a model uniform food law, which many states would go on to adopt. The model law is one of many guidance documents that AFDO will produce over the years.
The 1927 AFDO Model Uniform Food Law actually impacts counties, states, and the food manufacturing community altogether. It really is a cooperative way for AFDO to take the lead to help create a framework for uniformity that's utilized even today. Uniformity that started back in 1927 has been so important for the industry. It has helped industry understand what the rules and regulations are, not only from the county level, but across states, that actually help to create trade and remove barriers of trade as food products are moved across the United States and now into a global arena. Integration doesn't just stop at the state lines. It's so important that we have uniformity in this global environment for industry.
In 1980, preemption became a huge issue for AFDO. The organization published a position paper on uniformity of laws and regulations and denounced federal preemption. The association would fight hard against preemption for many years, even when things looked very bleak.
We felt like it was going to drastically impact the ability of states and locals and tribals to be able to regulate our industry. The states and locals do, through a survey AFDO had done years ago, complete about 80% of the food safety work. They do the inspections. Technically, FDA cannot go in a retail food sales establishment or a restaurant without being invited by a state or local, whoever has the jurisdiction over that particular facility. So it has to work together, and we did not like the idea of having one group or one person sitting in Washington to totally control the entire food regulatory basis. A lot of stakeholders have input into that model food code, and AFDO has done a lot of work with others since this 2005, 2006 problem we had with the Uniform Food Act, that we have worked together. Standards have come out. AFDO has put a lot of model legislation together, a lot of guidelines together. So has FDA. And it has truly become a partnership based on an integrated food safety system that I think, because that bill, that uniformity bill, was basically defeated, it never passed, that we were forced then, in a piece of legislation that President Obama signed, and I think it was 2011, FSMA, Food Safety Modernization Act, we were more or less required, FDA and others were required to work together with the states and federal partners. Industry, we came with industry. One of the biggest things that ever happened in industry was when they started hiring food safety specialists within their operations so that we'd all talk the same language. But the standards that have come out of that for retail, for manufacturing, we're at a lot better place, I think, today because of that bill being defeated back in 2005 or 6, long in that time period. And we're working in a great place right now, I think, for food safety for the entire United States. It's a true partnership and I think a true integrated food safety system.
We actually went before Congress based on a request to testify regarding the Bioterrorism Act of 2002. That act had been passed previously and dealt with intentional adulteration concerns or food bioterrorism concerns. And we testified about the 4 major components of that bill and how those major components were necessary not only for the FDA, but for states and localities to be able to appropriately address concerns about bioterrorism or intentional adulteration of foods. This certainly was the first time that AFDO had been requested to come and comment on a specific bill, which was the Bioterrorism Act, but we felt that it was necessary that Congress understand the ramifications of this preemptive bill, because it would have essentially eliminated state and local food safety programs.
In 1994, the Seafood HACCP Alliance is initiated by the association through our regional affiliate, the Association of Food and Drug Officials of the Southern States. The alliance would become a model for a number of other alliances that would eventually be formed.
They had a great idea, and it was ultimately became the Seafood HACCP Alliance. It actually became a model for other alliances that have come about. And we reviewed it. It looked good, it looked sound, and I guess really the greatest thing, I think this was probably the first time that we've had a regional affiliate come up with proposed training or other needs that they put out, and we were able to take to AFDO and grow it. The impact of the Seafood HACCP Alliance was actually an international impact. We were able to take a proposed method of training out to national and international audiences. AFDO was able to provide certificates of training that was recognized internationally. We were able to get training to needed places using both different training venues and also the regional affiliates and AFDO. So it became a boon to developing other types of alliance situations, such as the Produce Alliance and Juice HACCP. You've got several of them that have grown out of the Seafood HACCP Alliance. AFDO's got this unique ability to take issues that are maybe of concern in one area of the country and take it out to another part of the country, or even internationally for that matter.
In 1997, AFDO's president, Dan Smiley, addresses the Regulatory Affairs Professional Society's annual conference, and he also spoke at the USDA's Food Safety and Inspection Services annual federal state conference on food safety, where he advises attendees of AFDO's vision of a nationally integrated food safety system.
George Burdick had asked me to come and talk about what I thought food safety would look like in 5 years. And at the same time, the federal legislature had said that they were going to balance federal budgets in 5 years. Well, that meant that some money was going to be cut somewhere along the line, and it just felt like you need to start talking about then merging all this stuff so that all of our resources are going towards the same goal and protecting the consumer from food illnesses and that kind of thing. And so on the plane to Washington, D.C. to that meeting, I started jotting down a few notes about integration of the systems. And I called it VINE, Vertically Integrated Regulatory. And I couldn't come up with a good word for the E. And that wasn't determined until a little bit later on, but we call it VINE for food safety, Vertically Integrated Enterprise for food safety. And at that meeting, it was the first time that I actually talked about it. And while president, I also sent letters to USDA and to FDA asking them to sponsor a 50-state meeting to bring people in from all 50 states to talk about this issue and try to work out what are the functions each level is most capable of handling.
In 2008, AFDO participates in a George Washington University Robert Wood Johnson Foundation project to describe in detail the history of previous efforts to develop a national integrated food safety system and provide specific recommendations for achieving that concept, with emphasis on the role of state and local agencies.
I see the project as an important step along a journey. And the next immediate step following the project was enactment of FSMA. And for the first time, the federal government, Congress, mandated that FDA build a national integrated food safety system. And I think the work that the community put into this agenda-setting project played a real role in having those issues on the table, central to the Food Safety Modernization Act process, because Congress recognized and expressed in the legislation in FSMA that there needed to be a collaborative integrated inspection system, for example, that state inspections should count towards the federal inspection frequency mandate, that FDA should invest in state capacity building, physical capacity building, training of people, lab capacity building, that the government had a role in funding that, and various mechanisms were established in the law for financing those operations. Congress specifically mandated that on the very visible, very controversial, challenging issue of produce safety, that program, that new program of produce safety standards would be a collaborative effort between FDA and the state agencies involved in produce safety. So I think the most kind of, I guess, lasting impact, was the enactment of a mandate, of a congressional mandate to establish a national integrated food safety system through FSMA. The journey is not over, and there's lots of room for thinking about, how we've done since FSMA was enacted, and then where we go from here. The idea of taking the mutual reliance idea that FDA originally created in the context of its international partnerships, and really apply that to the collaboration with the states, because mutual reliance really does speak to the formalization of the understanding that the state authorities and the federal authorities can truly rely on each other's work for the work they do, so that inspection findings and analytical results from states can be used, relied upon in federal cases. Likewise, information can be shared at the federal level that can be used by states to do compliance work. Again, the idea of mutual reliance, and along the lines of an agreement that just recently FDA entered into with the state of Utah, I think is a model, for how we can take those next steps, go to the next level in terms of creating a truly integrated national food safety system that really is about one system, not 50 systems plus local plus FDA, but really a truly integrated system that is making the best use of resources to prevent illness.
In 2009, AFDO helps to create the International Food Protection Training Institute through a Kellogg Foundation grant. One of the flagship efforts of this institute is the Fellowship in Food Protection Program, which was designed to help build the future food protection leaders.
From the very start, IFPTI identified the Fellowship in Food Protection Program as its signature program. This program is a leadership development program, and it's unique in that it is a program for government food regulatory professionals. No other program is like this in that it is focused on the integrated food safety system. So this program, and it's based on competencies and a competency framework for food protection professionals. The program has been a success, and it has produced over 10 cohorts of fellows. We know the fellowship program is successful because we track the fellows. What we have found is that 80% of fellows go on to assume leadership responsibilities. Some have become directors of their programs. Some now serve on national committees or work groups. Some are board members of national or regional associations. What we've found is that the fellows truly are the next generation of leaders in an integrated food safety system.
In 2011, the Manufactured Food Regulatory Program Alliance is established through an FDA cooperative agreement with AFDO.
The Manufactured Food Regulatory Program Alliance, or like we like to call it, the MFRPA, really is a network for state food regulatory programs that are enrolled in FDA's Manufactured Food Regulatory Program standards. These standards set forth kind of a baseline best practices that state regulatory programs can follow, and they cover areas such as their statutory authority, training of staff and assessment, inspection program, compliance, food emergency response, the food laboratory, and so forth. But these things all work together and hopefully form a basis under which the states are able to achieve a really high-performing and high-functioning program. The MIFRIPS Alliance provides that network for them to come together with FDA, collaborate with each other, share information, share best practices and resources, and develop new materials that are going to help enhance everybody's program. This really lays the foundation for mutual reliance, being able to accept each other's work and act on information we received from other agencies, and really sets the platform again for that nationally integrated food safety system that we're striving for under FSMA.
In 2014, the Retail Program Standards Grant Program is established as a partnership between FDA and AFDO. The grant program delivers funding to state and local retail programs to address their training and equipment needs, and also for innovative food safety efforts.
Harris County has undertaken several projects from the funding received through AFDO. We have been able to complete audits on multiple standards. We have been able to send staff to training that they otherwise wouldn't have been able to attend. We have used the funds to create an accredited food handler course for employees in the area. We have also been able to have our annual food safety summit that we put on locally in Harris County for the establishments that we regulate. Most recently, our newest project is updating our risk factor survey to automate the way we collect that data so we can see results from things that we're doing more rapidly than we would have been able to do in the past. These projects have had a very positive impact on the establishments that we regulate. The Food Safety Summit, for example, it gives us a non-regulatory format to educate and communicate with the establishments that are being regulated. We can get them the newest information, we can talk about code changes, and we can really educate and give them information that can help them promote food safety in their businesses.
In 2018, a collaboration known as Partners with a Common Purpose is formally launched by AFDO. The Partners recognizes a common purpose embraced and supported by both government regulators and industry alike in improving public health and consumer services. It is another example of AFDO's work in creating community among food safety stakeholders.
Partners with a Common Purpose is an organization that was founded solely on the premise that we, as members of the environmental health community, could come together as academia, as industry, as regulatory, have meaningful dialogue, and make a difference. And while there were certainly avenues to do that prior to Partners, what we found is that, it was really prescriptive. And so there wasn't a safe place for people to share ideas, that no judgment zone where we could really build the trust of the members of our community to the point where we could explore ideas that may not be popular and give everybody a voice. And so when I think about Partners and AFDO, it's a no-brainer. We're already seeing the fruits of our labor. When you think about Partners, it started out as a session in a conference with AFDO where we brought our membership together to have some robust conversation. What it turned into is it turned into a culture, and it made us think about the concepts surrounding Partners and to really adopt them in other ways. So when you go to sessions and you see this come to life, where you've got everyone in the room, where it's not just a presenter on stage, but we're facilitating meaningful dialogue among the membership, that's Partners. You'll also see our partner members out in the community, out in these key organizations, really being ambassadors for the concepts that make Partners successful. And that's nothing but, sheer will and grit of AFDO really coming in, helping to lift up this organization when there was nothing, and helping us to figure it out, and then to be multipliers of the concepts that bring people together in ways that are meaningful.
In 2020, AFDO sponsors a stakeholders meeting to discuss strategies for reducing foodborne illness to meet goals of Healthy People 2030. These strategies would eventually be shared with the U.S. Congress.
And in 2020, we weren't meeting the objectives. Salmonellosis hadn't changed basically in 20 years. There were objectives set, but there wasn't a plan for how to get there. And what was also happening is we were seeing outbreaks happening at the same place over and over again. We've seen over 40 outbreaks with leafy green since 2009. So we needed to pull people together to say, all right, how do we cause change? And the thing about AFDO is you've got the players. You've got the states, you've got the locals, you've got the federal government, you've got industry involved. So it was like, let's have a national meeting where we're pulling together the scientists and we're pulling together the leaders that can make things happen to develop a plan, but not just develop it, but implement it to actually reduce illness.
You know, history is not just who we are, but also where we've been and where we're going. And it really gives us a true sense of our identity.